As a young man, Dr. Lunsford was always fascinated by the most challenging scientific questions and the mysteries of the human mind. His love of adventure led him to Woodstock, meeting his wife and starting a family, and eventually to medical school. He followed medical school and began a fellowship in stereotactic and functional neurosurgery at the Karolinska Institute in Stockholm, Sweden. Subsequently, Dr. Lunsford joined the Department of Neurological Surgery at the University of Pittsburgh in 1980. There he pioneered the use of image-guided neurosurgery for the treatment of inoperable brain tumors. Dr. Lunsford explored new techniques which used radio-guided radiation to destroy diseased tissue with pinpoint accuracy while sparing living tissue. Today, these and similar minimally invasive radiological techniques are the standard of care around the country.
I think the quote that I probably like most as applied to medicine and probably many other fields is a quote from Montaigne, the French philosopher in the 16th century, and his quote in essence was that whenever something new is presented to the scientific community, the first response is it can't be true. And then when the truth of this is well established, the response is, well, it may be true, but it's not important. And then the final phase is that when the importance of this has been proved, the response of the scientific community is, well, it may be important, but it's no longer new.
Dr. Lunsford actually opened the door to all types of radiosurgery for patients in the United States. You know, he forged that standard of care for patients who otherwise would only have one option, which is craniotomies.
Well, Dave Lunsford is a special individual. He's like a scientific magnet, really. The philosophy is not necessarily about what the operation is or so on, but it's how the patient's doing. Is it possible to have them go home the same day as opposed to a week in the hospital? Is it possible for them to go back to work tomorrow as opposed to a month? And he has pushed the limits of how people think about brain surgery and created an environment that broke the rules.
All the people, I just think of all the people that we've helped over the years, and I just feel so blessed and so thankful that I was a part of the team and a part of your vision.
The people who aspire to this line of work are usually a special individual when it comes to the ego side, and Data is the complete opposite.
I am the 9,000th patient having gamma knife radiation surgery at UPMC Hospital. Congratulations, Dr. Lunsford, for your Physician of the Year award, and I'm glad I'm part of it, because what patient wouldn't want to have the best doctor in the world?
Well, not only was it red carpet, but the actual Oscar is really much better than the gold statue that the actors get. Perhaps my two personal successes in the field of medicine are related to two initial goals. The first goal was to try to bridge, perhaps even to tame the use of new technologies and to apply it to a variety of brain disorders in a minimally invasive manner. I'll never forget, at the other end of this bridge lies the individual patient and, as noted, the frightened family. The second goal was to transmit skills and a sense of caring and compassion to those who I have helped to train. This opportunity to be involved in the education of the next generation of medical providers is, in my view, the greatest reward of academic medicine. So I would like to say that in conclusion, I am extremely grateful and appreciative to the entire Castle Connolly organization and to all of you for this recognition.
Robert Carlson's father was a minister, his mother a nurse. It was their devotion to the well-being of others that inspired Dr. Carlson to pursue a career in medicine. After receiving his undergraduate and medical degrees from Stanford University, he joined the faculty of Stanford, where he is a professor of medicine. Dr. Carlson's career has been devoted to the improvement in the care and treatment of breast cancer. He chairs the National Comprehensive Cancer Network Breast Cancer Guidelines panel that develops the most widely utilized evidence-based breast cancer guidelines in the world. He also co-chairs the Treatment Guidelines and Allocation of Resources panel of the Breast Health Global Initiative, a group that develops resource-stratified breast cancer guidelines for countries with limited resources.
I'm continually humbled by how people come to me as new patients who I have never seen before, and they know nothing about me other than someone recommended me to them. They come to me, and within an hour of meeting them, I'm assisting them in making some of the most important decisions they've ever made in their life. What an honor, what a privilege.
He's just a remarkable man. He's wanted by everyone.